Hey mama, so today we're going to be talking about one of the major breastfeeding challenges, and we have a little series going on. This is breastfeeding challenge number 2, which is breastfeeding discomforts. And it's so typical. What usually happens is you think you have breastfeeding nailed, right? And then you get started, and then all of a sudden you're experiencing like sore nipples, engorgement, plugged ducts, and you're like, oh my god, this was not something that I was thinking was going to happen. And all of a sudden you find yourself in this position where you're like ready to throw in the towel. But it doesn't have to be that way. You can get back on track, and you can get like over those little hurdles and know how to tackle them maybe next time that they arise again. So the number one thing is latching. Latching actually causes all of those things: sore nipples, engorgement, and plugged ducts. So in order to avoid that, it's really important that you make sure that you have a deep latch. But what I mean by a deep latch is your nipple and your areola, or most of your areola, should be in your baby's mouth, and your baby's mouth should kind of like flange out a little bit, kind of like this, on the bottom lip too, like this. So then that means that they're actually suctioning on, so you can see them actually pulling in the nipple and the areola into their mouth, and they should be like a vacuum almost, so that if you kind of like stick your finger in there, it loses suction, and your baby will be breathing just through their nose, and you won't be hearing any sort of like smacking noises, and then you know that your baby has a deep latch. Okay, sometimes we call them like fish lips, so it's kind of easier to identify. Number 2 is if you do start to experience any of those like sore nipples, like you see cracking around your nipple area or anything like that, bleeding, or your nipple kind of looks like a lipstick, the shape of your nipple changes, make sure that you're using a good nipple balm, preferably coconut oil based, so that it's safe for your baby. And things like coconut oil, olive oil, calendula, flour, all those things help to restore and heal the skin very, very quickly. And on top of that too, it prevents any sort of infection, so that you don't get things like mastitis and stuff like that. Okay. Number 3 is going to be warm compressions, and it's super easy. It doesn't have to be anything sophisticated that you use. It could be one of those pads, gel pads that you can heat in the microwave, or you can even just put really hot water on a diaper. Or one of those water bottles. Make sure you fill it out with nice warm water, and you kind of want to be putting it all over your breast. And during that time, you want to be doing warm compressions. So you should be doing kind of this to your breast, kind of like if you're eating a sandwich, or like a C shape, and it should look like this basically. The other thing too that you want to be doing is like massage, which is like circular motion massage. So you want to be doing this all around your breast, and that will actually like kind of like smooth out those milk ducts, which the milk ducts basically are getting plugged. So those are, imagine little veins, and they have like, there's dry milk that has started clumping up, and it's preventing the milk from being able to run smoothly. So by doing that, you'll get rid of those ducts, so that they kind of like dissolve away, and then that way it prevents you from getting engorgement or mastitis, even worse. And it's very, very normal as well during the first few kind of weeks of breastfeeding, because your milk is still regulating, so you're producing a lot of milk, which can cause those ducts to get plugged as well. Anyway, I hope that these little tips and tricks helped, so that you can feel confident to get back on track again, and you don't let those little like hurdles be the end of your breastfeeding journey. They really don't have to be. It's very normal that they happen, but it is important that you get to work right away, getting rid of them before they become a problem. Bye, mamas.